Hi everybody, Dr. Kristen here from Every Family Chiropractic Center. Today we're going to talk about asthma and allergies. This is an important talk because incidence of asthma and allergies is increasing every year, and we definitely notice this trend here at the office. There are way too many kids coming in under the age of 10 or 7 or 5 even who are already having to use inhalers all the time and are also getting allergy shots. And most parents who bring their kids in, they don't want their kids to be dependent on inhalers. They don't want them to have to get allergy shots and keep taking medication. So my goal today is to arm you with enough information to help avoid that reality. So why talk about asthma and allergies right now? Well, we're still at the end of what people like to call the cold and flu season. I'm not the biggest fan of calling it the cold and flu season, primarily because it's not like all of a sudden the cold and flu virus want to come out because it's winter, but we have a tendency to create the cold and flu season ourselves. And we do this by lowering our immune system. So we tend to be less active during the cold months, and I'm sure plenty of you have heard the catchphrase, sitting is the new smoking. And the reason they say that is because a decrease in activities, spending more time sitting around, is going to decrease your health. It's going to lower your immunity. And then, of course, we have the increase in sugar that tends to happen during these cold months. It has to do with the holidays. And then, of course, people indulging in comfort food because they are cold and uncomfortable. And I get it. I sometimes find myself in the same spot. Right now it's Girl Scout cookie time, and you better believe that I'm having a hard time avoiding those. Also, one thing that we can't really control is the decrease in sunlight. So especially here in Michigan, we get a lot of cloud cover. It's hard for us to get out there and get in the sun and actually get vitamin D. So it's important to, if you are in a place like Michigan without a lot of sunlight, that you get out, that you supplement with vitamin D to help make up for that. So being cooped up inside, no good for your health. So you can see we aren't exactly getting sick because we're getting exposed to germs. Our immunity is going down, and that is why we are getting sick more often, and that is why allergies and asthma tends to ramp up a little bit during this time of year. So our main goal for our patients that do have asthma and allergies is to help boost their immune system. So now let's talk about asthma specifically. So asthma affects more than, I think it's like 25 million people in the United States. And like I said, the rates of asthma continue to rise. And that's a scary thing because asthma is not something that you want to mess around with. There are people that die because of it, because asthma attacks are no joke. And the thing with asthma too is it's mostly affecting teens and children. So that's not what we like to see. Our goal here at the office, and why we try and get so many kids in here, is because if we create healthy kids, we are most likely then helping lead them into a healthy adult lifestyle. And healthy adults means a great future, right? So anyways, back to asthma. What are some of the things that could be causing this increase in prevalence in asthma? Well, for one, a major one is the increase in chemicals that are now in the environment. And these are chemicals that are in the air, the ones that we can't really escape unless you go live in the mountains somewhere. Chemicals in our food, of course, lots of chemicals in our cleaning products, and especially in the stuff that you put on your body. If this is becoming more aware to the public because of these brands that are coming out that boast that they have fewer chemicals, but that is a big deal, the amount of things that we are putting on our body that have a lot of toxic chemicals in it. So we're being overloaded with chemicals, and that's a big part of why allergies and asthma has continued to increase. Another thing is during the cold months, people tend to keep their homes locked tight. And when you do that, you are trapping chemicals again, and then molds and other irritants. So the people who are suffering from asthma and allergies due to having a mold issue, a sensitivity to mold, that definitely doesn't help. And there's not much you can do there, because I'm not going to tell you to open up your windows in the middle of winter. Another big culprit is that kids these days actually just have a weaker immune system, and that can start as early as birth. So the increase in C-sections continues to rise, and one of the downsides of a C-section is that when a child is not born vaginally, they are right off the bat missing out on a lot of healthy bacteria that would have normally been given to them from mom. And that healthy bacteria goes to the baby's gut and immediately starts the process of increasing immunity. So that increase in C-sections is right away decreasing someone's immunity for that kid. We're also giving kids antibiotics a little too early and way too often. We are in a culture that's very afraid of germs and very afraid of any type of sickness and illness, which I can understand. No one wants to see their child sick. They don't want them to be uncomfortable. It makes them nervous, so they feel comfortable giving them an antibiotic. I understand that. However, giving antibiotics a lot and immediately decreases immunity. So it's an absolute fact throughout even the medical community that if somebody fights something off naturally, that your immune system becomes much stronger after that. So you'll notice kids who actually fought off the flu, they don't get the flu as often anymore because their body's able to fight it much easier than those who were always given something to fight it right away because their body did not naturally fight it off. So immunity is a huge part of why asthma and allergies continues to decrease. But I don't want to get too much into all of that. So I'm going to move on to what exactly is happening in the body when someone has an asthma attack. And for starters, let me tell you, it's a terrifying thing for somebody to have to go through, especially for parents to witness their child not to be able to breathe, and the constant fear from the child and from the parents that they are going to have an asthma attack again. And, you know, hopefully they've got their inhaler around. But basically what's usually happening and why we link asthma and allergies together is oftentimes asthma is brought on by an exposure to an allergen. And when they are exposed to that allergen, what's happening is there's this inflammatory reflex within the body, and it's causing inflammation of the bronchioles within the lungs. And that inflammation makes it so that air is struggling to get through the body. And, you know, dysfunction of the cervical spine, which is our neck, dysfunction of that can also play a big role. There have been a lot of studies showing a decrease in asthma attacks due to chiropractic treatment of the cervical spine. And a lot of that just has to do with the affecting how the nervous system responds to an allergen. So I'm going to move on to allergies now. And most of you are already pretty familiar with the typical signs of allergies, especially if you live here in Michigan. You know, itchy eyes, runny nose, sneezing. Some people have skin reactions, and then of course, issues breathing, so asthma. Some people have an allergy to peanuts or an animal or eggs. So what's the deal? A lot of times we blame the substance that we are having an allergic reaction to, but in reality, you know, not everyone reacts the same to these substances. So what's going on? The issue is that the substance that we are allergic to, our nervous system is inappropriately perceiving that allergen as a threat. So basically it's having an egg, and if you're allergic to it, it should not have a reaction. Eggs should not be an issue for you, but your nervous system is sensing something bad, even though it shouldn't. So our goal in the office is to affect that neurological problem and then also help increase the immune system. There are some things that we can't necessarily control, like your endocrine system has a lot to do with your response to allergens, but we can't really address that completely in the office because a lot of times that has to do with your estrogen or progesterone or your thyroid. And those are things that usually like a naturopath or a nutritionist can help you deal with. So our goal is to focus on that neurological component and that immunity component of allergies so we can help decrease the amount that the body reacts and help you adapt better to an allergen. Oftentimes in the office, I tell people that one of the issues is we're trying to make it so that their bucket doesn't get full. So what do I mean when I say that? Imagine you have a bucket in your body, okay? So everything that causes inflammation within your body adds water to that bucket. If you add an allergen and that bucket's already full, the water is going to spill over, and then you're going to have symptoms. So we have to decrease the other things that are adding water to the bucket. So anything that causes inflammation basically is adding water to your bucket. So that could be anything from stress, not sleeping well, eating a lot of sugar, not being active, so on and so forth. I think you all know what can cause inflammation within the body. I will go over it though later, just in case. So there are millions of kids out there suffering with a fear of another asthma attack, or having to stay out of school because their allergies are so bad, and that causes the parents to suffer too. So that's why I'm speaking to you parents, even though you may not be suffering from asthma and allergies. We have kids in our office just a year old exhibiting pretty significant allergic reactions to foods that are being added to their diet. Like as soon as a parent starts adding eggs or something with peanuts, their child is having a severe reaction, and that's not something that should happen that young. So that's why we like to talk to you about it, because we want to fix this issue. You know, I remember even back when I'm 32 and 32 years young, and I remember back when I was, gosh, like 7 years old, and having to accompany my mom to the doctor's office with my younger sister who was 5, and having to go through her getting shots for allergies and doing all the allergy testing. So this isn't necessarily a new problem, but it's definitely getting more and more common. So it causes things like, you know, kids are suffering from this. They're missing out on a lot of the activities that they should be able to enjoy. Some kids aren't able to play sports because their allergies are so bad that they can't be on a soccer field playing a sport they want to love, or they have to constantly use an inhaler to be able to do that. They have to miss out on school often and miss out on events with their friends. And, you know, having asthma and allergies also lowers your immunity because it's going to affect things like your sleep. It's causing inflammation within the body. So a lot of times these kids are actually more susceptible to viruses like the flu or the cold. And so it's not just the asthma and allergies that's affecting them, it's affecting their overall health. And most parents don't want their kids to suffer from asthma and allergies and have to depend on all these different things to help them, like inhalers, allergy shots, allergy medication. So what can we do to help decrease asthma and allergies, or at least make it so that it doesn't happen, things don't happen as often? Well, we got to build the immune system, like I've been saying. So remember that the gut is huge for immunity. So feed your gut the good stuff. And what's the good stuff? Well, probiotics are very important for your gut health. Giving yourself the right nutrients. Bone broth is great for your gut. Fermented foods, so that could be drinking kombucha, or oh, my mind is blanking on sauerkraut. That's what I want to think of for a fermented food. There are quite a few out there, kimchi. So those are all great for your gut. And then of course you want to combat all of the things that I talked about at the beginning of the video that correlate to why we actually have a flu season, and that includes stay active. So don't spend so much time sitting around. Try and get outside, bundle up in the winter, and get the body moving. I want you all to eat well, so don't overload yourself with sugar. Get outside, get in the sunlight, get your vitamin D. If you can't get in the sunlight, go ahead and supplement with vitamin D. And then, of course, do things to work on your stress. So that could be anything from meditating, or if working out helps you, going on walks, decreasing stressors in your life. That's going to help increase your immunity as well. So when you're coming to a time period where you know your allergies tend to get a little out of control, so a lot of people, spring is a big one for them when all the flowers start blooming and there's a lot of pollen in the air, do extra stuff for yourself to decrease any other things that are causing inflammation, so that you're not having that bucket be so full when pollen gets out of control. So when it comes to diet, add in a lot of anti-inflammatory things like curcumin, which is turmeric, and garlic. And go ahead and Google anti-inflammatory foods. Eating vegetables is great for you also. So include those in your diet and try to cut out inflammatory foods. So the biggest culprits for that are, of course, junky sugar, bad carbs. So when I say bad carbs, I mean like the processed, like pasta or potato chips, those types of carbs. And then red meat is a big culprit for inflammation, and then also dairy. So fill your belly with the good stuff. Fill it with veggies. Do the probiotics. Avoid the things that are causing inflammation. Sleep's really big too. So if you know you're getting towards that allergy season for you, make sure you're getting a lot of sleep, because sleep is the time for your body to heal. So even though you're someone who can function on 4 to 5 hours of sleep, I want you to try to get 7 and 9 so that your body has that full rest period to actually heal and decrease inflammation within the body. Increase your water intake. Drinking enough water is going to help flush out toxins within your body. And like I talked about, chemicals and toxins are a part of why our immunity is so low. And of course, get adjusted. And I say it over and over to patients that improved immune function is one of the greatest and most common results of getting adjusted. And that's just because we're allowing the nervous system to work better. If your brain is talking to your body the way that it's supposed to, you're going to be healthier. More specifically, when we're affecting the vagus nerve, which comes out of your brainstem up here and goes to a bunch of organs within your body, that nerve functioning properly allows your inflammatory reflex within the body to function, where what that basically means is the vagus nerve is a huge part of your body's innate intelligence to respond to inflammation. So if that nerve is not talking well, how do you think your body's going to respond to an allergen causing inflammation? Not very well. So adjustments are very important for that. Adjustments are also great for the stress part of what is causing allergies to be worse. Stress decreases your immunity, because when we are adjusting you, we are stimulating that parasympathetic nervous system. So we're putting into rest or digest mode, decreasing anxiety, decreasing stress. So those are definitely some tips that I want you all to try and take down when asthma and allergies start to get out of control. There are plenty of studies out there showing how chiropractic has helped decrease the incidence of asthma attacks and also decrease the severity of allergies within the body. So be healthier, decrease all the things that are filling up your inflammatory bucket, and hopefully that helps with the whole asthma and allergy issue. And if any of this information that I shared today sounds like something that you need to hear more about, please don't hesitate to contact our office. We would love to chat about how we can help alleviate the symptoms of asthma and allergies. So again, this is Dr. Kristen at Van Every Family Chiropractic Center, and thank you so much for listening to my chat today, and I hope you all have a wonderful week. Bye.